Cameroon, a land of resilience, but beneath its surface, a silent killer lurks, affecting thousands every year. Despite progress made in tuberculosis control, the infectious disease continues to challenge the nation's healthcare system. This is the story of Cameroon's fight against tuberculosis.
As far as 2023 notification figures are concerned, we notified roughly 25,722 cases in 2023. That is roughly the half of what is expected by WHO, because WHO is expecting roughly 47,000 cases per year. And among these 25,000 cases, we have 5% of our children concerned. We should notice here that children should be notified between 10 to 12% of all notified TB cases. Besides these figures, we had in 2023 co-infection rate of HIV and TB of 17%. Serious issue is also MDR TB cases, so multi-drug resistant TB, which remains also under-notified, with only 186 cases notified comparatively to 400 cases expected by WHO.
The contagious infection attacks the lungs, brain, and spine, leading to bad cough, fever, night sweats, weight loss, or no symptoms at all, depending on the form of TB. In Cameroon, there exist 347 decentralized diagnosis and treatment centers where patients are tested and treated for free. The Yaoundé-Jamo Hospital is one of the reference centers where TB cases are managed.
They do normal consultations, and when the doctor finds out that they have symptoms of tuberculosis, they request for TB test, which is free. And when the test is done and it's positive, they place them on treatment, which lasts for up to about 6 months, depending on or even more, depending on the type of TB and on the situation of the patient. We have access to treatment here in Jamo. We have treatment for all our patients, and it's free for the patients.
La tuberculose multirésistante est une forme de tuberculose résistante, comme son nom l'indique, à la rifampicine. Ça veut dire la tuberculose sensible, qui est la première forme de tuberculose. Le patient, après examen, on constate qu'il a une résistance à la rifampicine, qui est l'une des molécules primordiales dans le traitement de la tuberculose. Dans ce cas-là, le traitement est plus long. Dans la tuberculose sensible qui dure 6 mois, mais chez les multirésistants, c'est 9 mois de traitement. La phase intensive, 4 mois, et la phase de continuation, 5 mois. Là, les malades prennent beaucoup de médicaments. Ils prennent 7 qualités de médicaments pendant les 4 premiers mois. Et les 5 premiers mois, on enlève 3 autres et ils continuent avec 4 molécules.
However, due to limited resources, health facilities often struggle to maintain accurate records and follow up with patients.
La principale difficulté que nous avons, c'est le masque de protection. En principe, on devrait avoir un masque filtrant tous les jours. Mais à défaut, nous avons les masques chirurgicaux, ces simples masques-là que nous avons quand nous allons en contact des malades.
Nous avons un problème de repère parce qu'au jour d'aujourd'hui, on voudrait dépister précocement tous les malades contacts avec toutes les personnes contacts avec les cas index, c'est-à-dire que ceux qui ont fait la maladie. Bon, ça fait donc au moment où nous pouvons les traquer, il n'y a pas de moyens. Il faut une descente sur les lieux. Heureusement qu'au jour d'aujourd'hui, nous sommes appuyés par des partenaires, par exemple CARE, qui nous vient en appui. Bon, on sous-entend qu'au cas où CARE partira, quel sera notre sort. C'est pour cela qu'on essaie un peu de tendre la main aux ayants droit de nous appuyer afin que la recherche active soit effective au niveau communautaire.
This man, in his 40s, is one of the patients undergoing treatment at the Jamu Hospital after being diagnosed in September 2023. He accepts to talk to us in anonymity. He says he has all the support he needs, but he is finding it difficult to keep up with his dieting.
En prenant ce contenu, il faut d'abord beaucoup manger. Bon, pour le suivi, la famille s'en occupe. De temps en temps, il y a les ONG qui nous financent. Par mois, on nous donne un petit peu pour pouvoir se débrouiller avec. Avec les temps qui sont durs, vraiment, il faut vraiment un support solide.
While he is responding to treatment, there are other unidentified patients posing a threat to the community. In Cameroon, one of the major challenges in the fight against tuberculosis is a high number of missing cases.
You have missing cases in community, so you have to find actively cases either in the hospital or in the community, because people can present symptoms of TB, but they are not aware of the severeness of the disease. That's why the program now moves either in the community or in all the entry points of the hospital to look for TB cases. You can also have very late diagnosis. People arrive at the hospital at the very late stage of the disease when we cannot do anything. And as I was saying, the co-infection between TB and HIV remains a real problem. When you don't act on these risk factors, it will be difficult to end TB in our community.
The early detection of cases helps reduce the burden of the disease. In order to better identify these cases and curb the notification gap, the country is embracing innovative diagnostic tools.
Efforts are being done either in diagnosis, treatment, and prevention of TB. As far as diagnosis is concerned, the main spearhead of the program now is to continue the active case finding that we started since 2020, and that consists to find TB either in the hospital or in community with the help of community health workers, with the help of TB mentors, and we have also the capacity building of our health personnel to have a reflex to find TB as soon as possible. You have the scale up of the molecular test.
We are used to test, but as of now, the government has already reinstated the procedure. So we're still waiting for the implementation of the urine testing. Though some research is being carried out with that testing.
All right. So can you share with us maybe your expectations to make your work better?
Like if you talk of the urine testing, I think that one will ease our job, because everybody can do urine testing. Even you are not trained, you can be simply trained. A simple nurse can be trained. We can carry out in the ward. That will just reduce our own load work here in the laboratory. And then we are also requesting for TB lab that we used to do, but for about some years now we don't do it. It's a very nice process of testing tuberculosis, and very sure, like more than that of the microscopy.
Another instrument being used is the mobile application One Impact, created by the non-governmental organization for impacts in social health, FEES. Since 1996, FEES has been supporting the government fight tuberculosis. The One Impact application provides the necessary information on tuberculosis, where to get treatment, and a safe space for people living with tuberculosis.
If you want to go in a hospital where they take in charge TB, yes, this part helps you to know where is the nearest hospital you can go to. So it depends. For instance, this is my position. Where can I go? It will show me.
But this battle with TB in Cameroon is not only about embracing technology. With increased awareness, improved case finding, and adequate financing, the country can achieve its 2030 goals of beating tuberculosis and saving lives.
The awareness to increase, it is through sensitization, through communication. There is a need of visibility for tuberculosis, because when you talk about HIV, when you talk about malaria, people knows what you're talking about. But when you talk about tuberculosis, there is a lot of stigma, as you're saying. And you know that if you want to clear stigma, if you want to resolve that one, it's through information. That's why we are calling for medias, we are calling for the government, we are calling for parliamentarians, we are calling for everybody to look further information about tuberculosis.
To find missing cases means we need also more funds, because so far we should say that our national strategic plan, where activities are is only financed at 30%. So we still have a gap of almost 60%. That's why this is a way of doing an advocacy for more donors to come and help the government, to help the country to fight this disease by the year 2030, by bringing more funds at our level.
Though the fight against tuberculosis seems far from over, the dedication of healthcare workers, community support, and the commitment of policymakers, a TB-free future is within reach in Cameroon.